Hello, welcome to How You Living, short version. So the shorts are us being able to come to you and give you more information so that you can live your better life. So today, Dr. Kiva, your chiropractic yoga person, is going to talk about the knee. The knee. The knee is one of our largest and more complex joints that we have in our body. So let's kind of understand what makes up the knee. So first, when we look at the knee, we have a large bone called the femur. That's your thigh bone. So your thigh bone is your femur. Coming from your thigh bone or your femur, we have your tibula. Your tib is a really big bone that's on your shin. So these two bones meet and they make up your knee joint. And along with that, of course, we have our little patella. So the patella that is with the knee, it helps the knee to go for flexion. Along with the patella and the bones and the femur and the tibia, there's also ligaments. We have a ligament that's on the lateral side and a ligament that's on the medial side, the inside of your knee. In between each of the bones, we have our meniscus. And then even crossing behind the knee, we have what we call the cruciate ligament, an anterior cruciate and a posterior cruciate ligament. So these are the ligaments and the bones of the knee. So with this being my right knee, coming from up here, I would have my quadriceps. So this is the quadricep tendon. And going under this is the patella tendon. Behind the knee, right here, we have our hamstrings. So our hamstrings also cross the knee joint. So it's with the quadricep and the hamstrings that we have flexion and extension of the knee. Now there's a lot of problems that people can have with their knees. Some could be like knee arthritis, where there's basically that wear and tear just of living life. You start to develop some arthritis. You can have some infusion or really some fluid that's on your knee. And a lot of times we get fluid on a knee based because something is going on. It could be a tear, it could be arthritis, it could be something traumatic that we have some fluid in the knee. You can have, of course, tears to your meniscus, tears to any of these cruciate ligaments. You could tear a tendon and then all of a sudden your patella is just up in your knee. I've actually seen that happen with a patient. So how can you keep a healthy knee? So a few things that we are going to understand when it comes to the knee, as I bring up Mr. Henry here, is that the femur is coming from your hip. So any kind of way that your femur is how you were born is in the hip could also affect the knee. And what else could affect the knee, of course, are your feet. If you have flat feet, your knees tend to cave in towards each other, which can also affect your knee and your hip. But in order to get a strong knee or for knee rehab, we have to focus on those muscles that are around the knee. So by strengthening the muscles around the knee is going to help with knee health. So there are a few exercises that you can do to help strengthen the knee. One, of course, is knee extension. So if I'm sitting, I can add a little weight to me, and then I can extend the knee, which is going to help with quadricep. Along with knee extension, you can have knee flexion. So that could be like a little hamstring curl, where you're strengthening your hamstring, which is also going to help with your knee. We can do wall squats, where we just sit on the wall and hold it. Maybe you can make it up to 3 minutes, where you just hold, and this is also going to help with quadriceps and hamstrings. And of course, we have our regular squats, which is also going to help. Now, I mentioned quadriceps and hamstrings. Let's talk a little bit about the glutes. Weak glutes can also cause knee problems. And that's because glute max ties in with another little muscle called tensor fasciae lata and becomes the IT band that goes down your leg. So that means if glutes are weak, it's going to mess with the tracking of your knee, which is going to cause knee problems. Squats can help with your glutes also. And say you like, well, I don't necessarily want to do a lot of weight bearing stuff. Swimming is great for the knee. So you can always get into the pool, go swimming, maybe even just do some running in the water or walking in the water. That'll help with your knee. And of course, if I mention squats, we can also do lunges. A lunge is going to help with the knee. So there's a lot of exercises that we can do in order to build the knee. Just focus on muscles that are around the knee in order to help with any knee pain that you may have. Now, of course, if you have extreme pain, still go see your doctor. They might have to do x-rays to see the bone, or they might have to do an MRI to see if something is torn. And then if there's more going on, then possibly you have to go into more intensive therapy for your knee. But I would suggest just start to work on strengthening the muscles around your knee to have better knee health. Thank you guys so much for joining me on How You Living Shorts. I'm Dr. Kiva. And if you have any questions, feel free to reach out at amobilebody.com and I'll answer any questions you may have. I hope you have an awesome rest of your day and a strong knee. Thanks. Peace.